Hello everyone, welcome back to the channel. If you're an internationally trained dentist preparing for a bench test, there is one question that almost everyone asks. What exactly do I need to buy to practice at home? Because when you search online, the information is either confusing, incomplete, or somebody just shows equipment without explaining anything. And before you know it, you have spent $2,000 buying random things that you don't even need. So, in this video, I will show you everything you need to prepare for your dental bench test. We will talk about typodonts, teeth, handpieces, compressors, burs, instruments, loupes, and the small things that nobody talks about. By the end of this video, even if you have never prepared for a bench test before, you will know exactly what to buy and how everything works. And I promise to explain so clearly that even somebody who has never seen a dental typodont before will understand. So grab a pen. This video might save you hundreds of dollars. Before we start buying equipment, it's first important to understand something. There are two ways people prepare for bench tests. Option one, the bench test preparation courses. You attend the course. They provide typodonts, handpieces, instruments, materials. You simply come and practice. This is easier, but it can be very expensive. Some courses can cost between $2,000 to $5,000 on a monthly basis. Some practice centers will not provide you handpieces and materials or equipment. They will provide you a compressor and a dental chair. You basically have to buy the rest yourself. Option two, your home practice setup. The second option is creating your own practice station at home. For the home setup, this is what many internationally trained dentists do. Because once you buy the equipment, you can practice every day, anytime, without paying hourly lab fee or monthly lab fee, as the case may be. But the question here is, what exactly should you buy? Let's break it down step by step. The typodont is basically your artificial patient. It is a model that contains artificial teeth where you practice procedures like crown prep, cavity preps, restorations, and others. Most bench tests use typodont models such as Kilgore typodont or Columbia. Different schools use different models. So the first rule is always confirm which typodont the exam uses. Kilgore typodont is very common, also affordable, but here is something many candidates don't know. Kilgore typodonts can come in different series. For example, the 200 series or the 700 series. But guess what? The teeth are not interchangeably. Sometimes you may not know the difference between the 200 and the 700, but it's usually written on the typodonts. Okay. The teeth are not interchangeable. The 700 tooth will not fit a 200 series typodont, and vice versa. Imagine buying 50 teeth only to realize that they don't fit. Yes, people have done it. The Colombian typodont is another commonly used typodont, but Colombian teeth are different from the Kilgore teeth. They cannot be interchanged. Even the screws are different. For Colombian typodonts, anterior teeth use a different screw, and so the posterior teeth also uses a different screw. But Kilgore uses the same screw for teeth. Small details. Big headache if you don't know that. When you start practicing, you realize something. Teeth disappear very quickly. You will cut, you will overcut. Sometimes you will prepare a crown so aggressively that it will look like it went through a wall. This is normal. So buy lots of molars, lots of premolars, and lots of incisors. Usually, when you buy, it could come with a screw, or you may have to buy a screw if you lose your screw. Bench test involves repeated practice teeth, artificial teeth mounted in typodont models. So dentists buy original Kilgore teeth or sometimes the Chinese alternative. The cheaper ones are perfectly fine for practice. Now that you have your typodont, you will need something to hold it in position. This is called a bench mount. This mount attaches to your table and holds the typodont upright. Most mounts allow a 360-degree rotation and an adjustable angle. This is important because you want to simulate real patient positioning. Now we move to the heart of your setup, your handpieces. There are two main types. First, the high-speed handpieces. These are used for crown preparations, cavity preparation, cutting tooth structure. This is the main handpiece you will use. Preferably, get the ones with the lights. Why? Because visibility becomes much easier. And two, the slow speed handpieces. These are used for finishing, polishing, refining margins. There are two types of slow speed handpieces. The one that is friction grip, it allows you to use a high speed bore at a slower speed. It's very useful. We also have the latch type. This is used with latch burrs. Converters. Another small thing people forget is that handpieces come in different conversions. Some are 2-hole or 4-hole. So if you buy equipment from different places, you may need a handpiece converter. Handpiece maintenance. Very important. You need handpiece oil and lubrication nozzle. If you don't maintain your handpieces, it will die early, and handpieces are not cheap. Next is the electric motor versus the air compressor. This is where many people get confused. Your handpiece needs power. There are two main options to power your handpiece. Option one, the air driven compressor. This is closer to what you use in a dental clinic. It advantages it has air, water, which is for cooling. Disadvantages, it can be loud. If you live in an apartment and you start practicing at 11 p.m., your neighbors may start to ask questions. Your children may wake up. Your spouse may question your life choices. But there are quieter compressors available now. Option two, the electric motor. Electric motors are very convenient. They don't need compressors. They are quieter and they allow speed control, but they do not produce air or water spray. So when preparing a tooth, you may need a wet gauze to wipe the tooth. Let's talk about burrs. These are cutting instruments. You should have a mix of burrs. You have carbide burrs and diamond burrs. An example of carbide burrs would be 330, 245, and 169. And also diamond burrs. Example of diamond burrs would be round burrs, tapered burrs, football burrs, frame burrs. Bench test typically requires different burr shapes for cavity and crown preparations. I usually recommend buying about 10 of each type because burrs become dull. Dull burrs are dangerous. They lead to overheating, poor margins, and frustrations. Burr block. This is small but essential. A burr block holds and organizes your burrs. Without it, burrs disappear faster than socks in the washing machine. Hand instruments. Next are your basic instruments. You should have at least a mount mirror, probe, explorer, hatchets, gingival margin trimmers, mesial and distal. These instruments will help with evaluating preparations, refining margins, removing debris, and placing restorations. Your instruments can come in an instrument tray, or you can put your instruments in a tray. It helps for better organization and visualization. So, you will need an instrument tray. If you want to practice restorations, you should have a restorative kit. This may include plastic instruments, condensers, burnishers, or even covers. Let's talk about something that can completely change your practice: dental loupes. Magnification improves visibility, precision, and posture. Many dentists buy expensive loupes, but if you're just starting practicing at home, you can buy the Amazon loupes. It's usually 2.5 magnification or 3.5 for magnification. Then they come with an LED light and battery pack. Are they perfect? No. Are they good enough for practice? Absolutely. You could also choose to buy customized loops from any of the manufacturing companies. This usually customizes and gives you the best magnification that you would want. Instrument sharpening. If you use hand instruments like hatchets, they usually become dull. So you should have a Kansas sharpening stone. This keeps your instruments sharp. Also, do not forget that you will need consumables. You will need a face mask, you will need gloves, you would also need gauzes, cotton rolls, composite capules. and everything you need for your restorative set. My final advice: before you buy anything, always check which typodonts the exam uses, which teeth model is required, what procedures will be tested, because different programs test different procedures. Preparing for a dental bench test can feel overwhelming, but once you understand the equipment, it becomes much easier. So, in this video, we covered typodonts, teeth, mounting pole, handpieces, compressors, burs, instruments, and loupes. Everything you need to start practicing. If you found this video helpful, please like the video, subscribe to the channel, share it with another internationally trained dentist. This is License Ready with Ollie, where we keep you thriving as a foreign trained dentist in Canada.